All right. Hello and good afternoon. Welcome to a live broadcast with MedStar Health. My name is Kim Bosley. I'm the Director of Athletic Training Services here at MedStar, and I'm joined today by Dr. Corey Hudson. She's one of our sports medicine and emergency medicine doctors here at MedStar. Today we're going to discuss safety guidelines and protocols for coaches, parents, and athletes as they are returning to their sport in the new COVID-19 world. If you'd like to hear more about returning to sports safely, then stick around. Share this broadcast with your friends and family, and please feel free to ask questions for Dr. Hudson in the comments below. Dr. Hudson, welcome. Thank you so much for joining us.
Thank you.
Before we start, I want you to tell the viewers a little bit about yourself. I think that what's so amazing about your background and training is you bring a really unique perspective to the conversation, given all your career path.
Sure. So I started off in sports medicine about 20 years ago, actually as an athletic trainer. I studied at the University of Virginia and got my degree in athletic training there, and was a paramedic for a while and did some EMS before I went on to medical school. So when I do sideline coverage and sports medicine coverage, I kind of take the vantage point of all of those different experiences. I've covered games and races and events as an athletic trainer and as a paramedic and now as a physician. And I really enjoy working with all those different groups because I see how we work together so well as a team to care best for our athletes.
Mm-hmm. So I feel like as being athletic trainers, being in sports medicine, we're just making the assumption that our kids, our athletes, everybody wants to come back to sport. We just assume that parents want to put their kids back in sport. But that's probably not the reality in all the households. So is it safe for our kids to return to sport right now?
I think the simple answer is it depends. I'm a parent myself. I have two boys, and boy, I know my kids need to be active. We know it's important for our kids to stay active. It's important for them to be involved in team sports for social reasons, for fitness reasons, for mental health reasons. And for all of those reasons, as a parent, I'm right on board with the folks who want them to get back out there and get going. The healthcare provider side of me is a little more cautious and realizes that not all sports are created equal. I think that when we talk about sports like tennis and golf, when we talk about running or going outside and riding bikes, those sports are probably safe now as long as we're paying attention to distancing and wearing masks when we're close to other people, and certainly when we're in groups. I think that there's some gray areas. I think that sports like baseball, where there's still minimal physical contact between the players, is probably going to come online before sports like wrestling. And so I think the simple answer is it depends. And if we can put good guidelines in place and go back slowly, our goal is to get all of the kids back to the sports they love.
Okay, thank you. Well, speaking of guidelines and getting back, I know that all of our team here at MedStar, the physicians, athletic trainers, we've all been working diligently to put together some of those guidelines, and we're calling them the 5 T's. So do you want to talk through some of that with our audience? Do you want to start with tempering risk?
Sure. So tempering risk is all the things we've been hearing about for months. It's the way we reduce the spread of infection through good hand hygiene, through physical distancing, through contamination of high-risk and high-touch surfaces, and through the wearing of masks and face coverings when we're in small groups. All those things will help minimize the risk. They don't take it down to zero, but our goal is to temper or lower the risk of infection in our athletes and community spread.
The hot question, testing. Who needs to be tested? When? Why?
That is a hot question, and I think that in a perfect world we would have an unlimited number of tests with an immediate result, and we would be testing everybody every day to just know exactly where the disease was and exactly how it's spreading. Largely in our area, we have limited the testing to symptomatic or sick individuals, and those are the people we're testing in our urgent care centers, we're testing in the hospitals and in the clinics around the area. Testing asymptomatic individuals, so that widespread testing of people who look well, who feel well, is a strain on the system. And right now, as we're seeing other parts of the country have upticks in disease, we're seeing the turnaround time for those tests go from 2 days to 3 days to 6 or 9 or 10 days. A turnaround of 9 or 10 days makes it really hard to know how to interpret that result, because what we know is an individual was not COVID positive 9 days ago. We don't know what they are today. As we're looking at getting our professional athletes back, I'm sure everybody's heard about the plans that the NBA has and the MLB has and the NHL has for frequent testing. It's important to note that all of those leagues are very dedicated to using tests which are not the same tests that are being used by the hospital. So they've all made great commitments to make sure that they're not putting strain on local healthcare or delaying turnaround for patients who are sick. They're using other commercial entities for their testing. And certainly colleges and universities are looking at those same commercial tests to see if they may help us bring our college students and our college student athletes back on campus. Will there be a point where those tests are available for high schools and clubs? Probably. Right now they're rather expensive and they still have to be shipped out to outside labs. But I think this is a changing landscape. We're seeing new tests come on the market really weekly at this point. They all need to be validated. A crummy test is not useful at all. We need good tests. And so our team at MedStar, we have a great laboratory infection control team that are validating each of these tests as they come on the market so that we can get them out as fast as possible to everybody who needs them. So my hope and my belief is that 2-3 months from now, it's very likely that we're going to have much better and more widespread testing for asymptomatic individuals.
Thanks. Treatment. That's a tough one too, right?
It is, because as we know, there's really not a lot of treatment for COVID positive individuals. In the hospital, we're doing a number of things: antiviral treatments, steroids, oxygen therapy, but most people can manage their symptoms at home. They feel miserable. They feel like they've been run over by a truck, fevers, aches, fatigue, and most of this is caring for those symptoms at home. But under the treatment heading, I also put in tracking, which is that contact tracing piece, which is so important. And as our youth clubs and sports start opening, I think we need to recognize the importance of that piece of contact tracing so that when we have somebody who tests positive, we know how to reach out to anybody they've been in contact with and make sure that those folks are quarantining and staying away from the team and other people as well.
So what about training? So maybe I was COVID positive. Maybe I live in a household where my family member was COVID positive, and maybe I've been asymptomatic. What's the safe way for me to get back to sport or return to sport? Or what's our messaging for our athletes?
So first and foremost, for any athlete or any individual at all who's tested COVID positive, even if the symptoms were mild or even if they were asymptomatic, they really should be cleared by a physician before they go back to play. We know that there are certain individuals with COVID who get long or medium term, we don't really have long-term information, but medium term inflammation of the heart and lungs, which could pose problems when they go back to sport. So anyone who's COVID positive, we really want them to see a physician so that they can be cleared to return. If you're a household member of somebody who's COVID positive, say my husband's COVID positive at home, we've been separated as much as we can within the home, and there are CDC guidelines on how to separate within the home if you're living with somebody who's tested with COVID. And then I'm asymptomatic, I feel fine, I've completed my 14-day quarantine to make sure I've remained asymptomatic, I can gradually return to sport. And gradual is going to be the key, because after 2 weeks out of sport, we know that we need some period of acclimatization and reconditioning. We can't just pick up right where we left off.
So COVID positive, I should start with probably my primary care provider as a good baseline. They can guide me through any advanced testing that I might need to get back and doing what I'm doing.
Absolutely. Primary care provider will be an excellent start. Our MedStar Health primary care sports medicine team also happy to be involved in any of this decision-making process.
And the key is gradual. I can't just go right back out and do all the things I was doing, even if I'm the person that was asymptomatic in a household.
Absolutely. And this is one of the few places where we actually do have some data. Right, so there were studies that have been done after teams have had lockouts or teams have had shutdowns in the past, and we know that after 2 weeks away from sport, a significant amount of deconditioning occurs. And so there needs to be a gradual return to sport. It's also July in the Mid-Atlantic, which means it's hot. And so if we're going to outside sports, that part of heat acclimatization is also really, really important. We see, unfortunately, every year, even non-pandemic years, cases of heat illness and heat deaths, which happen when people are training outside in the extreme and even not so seemingly extreme temperatures. And so acclimatization to heat as well as reconditioning to sport is going to be critical after that downtime.
So we've talked a little bit about the timing of return, and we know some of that is going to align with whatever, our state and local guidelines talk to us about. But what are some things to consider in the timing of return as we prepare to get back or prepare for training and practice and competition?
That's an excellent point. So again, we're under our state and local guidelines for how large our groups can be. But once we can start gathering and once we can start having team practices, it makes sense to start with small groups, keeping people in distancing, doing some light conditioning, doing some skills work. You'll find that especially with kids, some will have been able to stay more active than others in this time. So going back to some of those individual skills, some of that basic conditioning will be very helpful, I think. And then slowly we'll move up to limited contact practices, and slowly we'll get back to full contact practices. This is likely going to be a 6 or 8 week progression, and that assumes that there's been no additional spread of disease in that time.
Okay. So as we're going back, there's all this hot question about, do I have my athletes go through a system checker every day before they come onto the field? Do I take a temperature? There's been this concept of maybe a parent pledge and that whole thing. So how do you feel about system checklists and prepping to come back? Who should be managing that also?
So I think symptom checks are important, and I think that the CDC, if we look at their list, and we'll have links to that within our page that's up, but the symptom checklist is always changing. We're always adding new symptoms to that checklist, but it includes things like fever, fatigue, headache, muscle aches, congestion, GI symptoms like nausea or vomiting or diarrhea, the loss of taste or smell. Again, this list keeps getting longer and longer and longer. But I think most of us at this point are pretty familiar with it. I think most of us have heard this checklist enough times that we are kind of constantly running through that checklist in our heads. So I think that, number one, parents and families and athletes should be asking themselves every day, how do I feel today? Right? Am I having any of these symptoms that everybody keeps talking about? Number two, does the coach at the gate have to ask a 20-point checklist for everybody? I'm not sure. I think, are you feeling well today? Do you have any new symptoms? May be adequate as long as that coach has had a discussion with the team and parents ahead of time that there's an expectation that everybody's going to be honest about symptoms, that we're monitoring ourselves and our families for symptoms, and that by coming to practice, that is your pledge, that your athlete and your family is still healthy and well. If I'm going to send one of my kids to a practice, I do that only if they're healthy and well, if everybody in our house is healthy and well, and I really trust that every other family on that team is going to do the same. It's kind of a social contract. We've all agreed that if we're going to get back to sport, we all have to follow these same rules. So we're only going to show up if we're healthy and well.
Got it. And then what do you think about the system checklist? Is that something that, from a HIPAA guideline, is that something that the coach should be handling individually, or do you get an athletic trainer involved? What do you think the best way is to handle that each time you're coming in?
So when we talk about HIPAA, I will first and foremost say I'm not an attorney and an expert in HIPAA law, but I will say that I think that just the global sense of privacy comes in, right? And I think that we have to ask, do we feel like coaches should be asking private medical questions of our athletes? And that may be different in different places and different leagues and different teams. But if the answer is yes, should they be doing that in front of their teammates? And that's also probably a tricky question. I would argue that maybe that's where we go back to start of the season if we don't have a place with an athletic trainer. This may be very different if you have a trained health professional taking care of your team. But if we're talking about county rec soccer teams, right, which often have parent volunteer coaches and a team of 14 or 16 kids, I think that a good team meeting at the beginning of the team where the coach says, look, I want you all to follow these guidelines. And if we're going to make this work this season, we need to all follow these guidelines to minimize the spread of disease amongst our team and amongst our families. We need to remember that even though my kid may be healthy and we may be healthy at our house, I don't know which of the children on my son's team might have a mother at home with breast cancer, or a grandparent at home with a kidney transplant, or any one of a number of other medical conditions that put them at supremely high risk. We have to protect all of them.
I really appreciate the concept of a social contract, right? You want your kids to play, you want them to be safe. You're assuming that you've done all the right things and you want the kids parents and families on your teams to do the same thing. I love that concept. I think that's really important.
So to me, that's the carrot. If you're going to take a carrot and stick approach, the stick is if anybody gets sick, we're likely going to have to shut down, right? So if we want to play the season, if we want to train, we've got to keep everybody healthy. And if we have cases of illness on the team, we're going to have to shut down practices. And so there's the good cop, bad cop. There's the bad cop side of that argument.
Right. But if we're all honest about it, we're doing everything that we're supposed to do. We keep our kids healthy. We keep them on the field.
And we can keep moving forwards.
We actually have a question, if that's okay.
Yeah.
We'll divert a little bit here. So Jill is asking, is mask wearing enough to keep kids safe, especially where sports are played in close proximity? So that's another hot topic. Should our kids be masked while playing?
That's an excellent question, Jill. And I think that the answer we know, and there are a lot of things we know and a lot of things we don't know about COVID-19, but we know that the wearing of masks and face coverings significantly decreases transmission of respiratory droplets between one individual and another. So if one happens to be carrying the COVID-19 virus and they are breathing heavily during a basketball game and they are up against a defender, a mask would reduce that transmission if both are wearing a mask. That said, we recognize that it's very difficult in many sporting situations to wear masks. And so I think that when we look at things like tennis and golf and these distance sports, I don't think it is necessary to put the kids in masks. I don't know that a lot of places are back doing basketball yet. I think we're working on it. Lacrosse and football have already started looking at special face shields that may fit into the helmet that may help prevent some of that respiratory transmission. I think that we have to ask, if getting that close together is that risky, are we ready to be that close together? And the answer for some of these sports that are really contact and collision sports, maybe we're not quite ready yet.
Okay. So we talked about our symptom checker, our parent pledge. The other question is temperature checks as a screen. I know that this is a very sensitive topic with some teams. I mean, we see it in just general work environments, temperature screens. Is this something we should be doing in sport?
So temperature checks are valuable sometimes. And I think the hard part is, in the hospital, if we're going to get an accurate temperature on somebody, we get a core body temperature, which, not to be icky, is usually a rectal temperature, like we do on infants and babies. We're clearly not going to do that before every soccer practice, right? But the next best would be an oral temperature. And again, in a lot of clinics and doctors' offices, we're used to getting an oral temperature taken. But that means lowering a mask and putting something in somebody's mouth. That is not what we're comfortable with right now. When we move to things like the tympanic, the ear thermometers, and the forehead no-touch kind of guns that people use for temperature checking, unfortunately the accuracy goes down a little bit. They have an error band and they're not always reproducible. If you have one of these at home, I dare you to try it on yourself or on somebody in your house 3 times in rapid succession and see how likely you are to get the same number 3 times in a row. And when we're looking for a fever, tenths of a degrees matter. And so accuracy matters. And so I think in many cases, we're doing something that has good intention, but we may not always be getting the best data. Again, we're also in the mid-Atlantic in July. And if you've been standing out in the sun, the surface of your skin is going to be hot, even if your core temperature is not hot, and you may get some false positives. Also, we know people's temperature fluctuates throughout the day. So 98.6 is a myth. 98.6 is close to an average of what you are during the day, but that's a fluctuation. CDC uses 100.4 as our cutoff for fever, so anything under 100.4 is not a fever. Anything over 100.4 is a fever. I think it's hard to get accurate data with any device we're going to use on the sideline of a lacrosse game.
And I think it's tough because some teams, some groups might not have the means.
For
You know,
sure.
they might not have the financial capacity to be buying all these things. So I think we go back to the symptom checker and we go back to our social contract. I think that's probably another good way to go back to that.
We want to put the resources where they're going to be most useful and not spend limited funds on things that may not provide a great deal of benefit.
So I'm back to sport. My team's playing. We're finally back in the swing of things. We're doing some activity. I've heard you say many times, it's not if, but when.
Yeah.
Someone is ultimately going to test positive. So how do we talk about that?
Yes, when we're talking to different teams and leagues around the area and we ask, they'll say, well, what do we do if somebody tests positive? You're right. I always chime in and say it's not if, it's when.
Mm-hmm.
It will happen. And if you make the circle wide enough, it will happen maybe sooner than you think, right? So we're not just thinking about our players. We're thinking about our players and our coaches and their families, because all of this matters. And I think that every team and every league needs to have a plan. They need to say how they're going to report that. Now again, that should be reported by the doctor or whoever ordered the test and how the test was done. But when we start thinking about contact tracing, the CDC says we should consider close contact, so anybody who is closer than 6 feet together for more than 15 minutes should be considered a close contact. And that's really within the 48 hours before the person became symptomatic or before the test, if they were an asymptomatic individual. So a 48-hour window, less than 6 feet, more than 15 minutes. And so I would argue that that's our goal in practices, is to keep everything more than 6 feet and less than 15 minutes, right? If we can minimize those close contact moments by doing educational sessions virtually, by keeping the huddle large, not tight, by not using the dugouts in baseball, but using the dugouts in the bleachers, right? Keep that distance wide, wearing the masks, wearing the face coverings. I think that we minimize the number of close contacts. Once you've decided who is close contacts, let's say our whole softball team goes out for pizza after practice, and they all take off their masks, and 8 athletes are all at one table eating pizza and drinking soda and having a great time because they haven't seen each other in months. Those are all now close contacts, and they all need to be quarantined for 14 days. And in a competition season, we've maybe just wiped out your entire team for 14 days. So that underscores the importance, again, the stick side of the carrot and the stick, right? Of how keeping that social contact and keeping that distance and keeping everybody apart may help keep us playing. But every team and every league is gonna have to decide for themselves, what is we call it the red line. What is the point where too many is too many, and they have to stop practicing, training, traveling? The answer's not gonna be the same for everybody. Is it gonna be 2 players on the team? Is it gonna be 6 players on the team? Is it gonna be 2 families down? It's gonna be different for every league.
Right, so it could be a percentage of athlete, or I've heard you discuss the severity of case, right?
Sure.
It could vary.
Sure. I mean, I think when we talk to high schools and colleges, nobody wants to talk about an athlete who gets hospitalized. We absolutely don't want to ever have to talk about an athlete or a family member who's died. But I think that severity of disease might force us to take a moment and pause and say, are we doing everything we can to minimize the spread? Are we ready to continue? Or do we need to push the pause button and reset just a bit?
Any recommendations for how you have that conversation? Like as a parent talking to a coach, and then a coach obviously having to talk to the rest of the team, because that will impact your contact tracing and the need for data and figuring out who was at practice those days and that kind of thing. So any suggestions on good ways to have that conversation? Maybe what you should say, what you shouldn't say. We want to be sensitive to that.
Yeah, I think honestly, this is part of the return to play conversation. I think we have this conversation before we get back on the field, not in the moment when it happens. I think we make sure that every coach and athlete and parent knows what the plan is going to be. If we have somebody who tests positive, we want to keep that private as much as we can, so it's not Susie tested positive on Tuesday. We have had a member on the team who has tested positive, so we're going to be doing some contact tracing. We do want to keep privacy as much as we can. We can use the State Department of Health or the local Department of Health to help us with some of that contact tracing. But I think athletes and parents need to know that there is a red line, and there are times where we may shut it down if we get too many cases, and that conversation happens before we start so we don't hurt too many feelings after we're going.
And then if kids are in cohorts, as you like to say, we might not have to shut down the whole team, right? Like if we've distanced and maybe offense is together, defense is together, or we've broken it down into different groups, we might not have to shut down our whole team. Maybe we only have to shut down one group or one cohort.
For sure. And again, that goes back to the idea of the close contacts. And if we minimize the close contacts, we minimize the number of people we have to shut down if we have a positive case.
Okay. We have a couple more questions coming in, if that's okay. So Jamie is asking, will we be able to allow sports that gather indoors, even as schools are fully virtual? So I know this is another hot topic. We're waiting for the governor to release some sort of messaging. I know we've talked to many of our partners in schools in the different counties to kind of see where they're headed. There's this concept of competitive sport versus keeping them active with intramurals. So this is just another interesting question, right? Again, Jamie's asking, will we be able to allow sports that gather indoors even if schools are fully virtual?
So Jamie, that's a really good question, and a lot of that is going to depend on what the school systems decide. Largely speaking, and I'll speak as a parent and a healthcare provider and someone who deals with this a lot, it's hard to make the argument that it's too dangerous to come to school for math class, but it's safe to come to school for basketball practice. So we need to talk about what that looks like and what that means. For schools that are utilizing a hybrid model, we've talked to many of the school districts and they are talking about a number of different options, from in-conference only play to an intramural style play to some sort of training programs, again, to keep the kids fit and active and moving, even if it doesn't mean a competition season. But for many of the leagues we talk to and many of the leagues we work with, the leagues will be shutting down the competition season or are discussing shutting down the competition season or limiting it in some way. So I think that we are a long way from those indoor sports, and I really hope we're in a very different place in October and November. I hope that we are looking at some of these hybrid models and we can get kids back into the classroom and we can get kids back into those indoor sports safely.
Okay. Jamie actually had another part to her question. She was asking more about how can we make changes in how we gather for dance programs? That's probably a little bit easier to distance. You can change your formations. Any comments on safely getting them back in person?
For sure, and I'm going to give some of this to Kim too, who's done a lot with dance and cheerleaders. But I think that getting inside for something like dance, where it might not be impossible to do some face covers, or as you say, change the formations. If you're talking about ballet, spread out at the bar, maybe fewer two-person formations and more widespread formations. It's something that takes some creativity, but I think that there are some ways we do that. It may mean smaller groups training at once. So rather than maybe having 10 or 20 athletes in a studio at a time, we're down to 6 or 8. What other ideas do you have for that?
I think it's really, formation-wise, it's just really how you can distance. I think that there's so much creative choreography out there and so much that the kids can do. I think there's lots of neat things you could do. Just as long as you're adhering to all the policy of social distancing and masking, I think you could probably be as creative as you want to be there.
Yeah, I think
it will challenge you.
It will absolutely. I know that there are a lot of people in musical theater who are considering the same thing right now. How do they go on with musical theater while they have to maintain the distancing? And I think it's going to lead to some very creative solutions.
And singing, because they say yelling and singing and being part of that can really project. So then there's a lot more specific questions from some of our listeners about specific sports. So Amy's asking, what about indoor swimming?
So swimming in general is thought to be fairly safe because the chlorinated pool water does protect you to some degree. Though lane sharing is tricky, and we do have to recognize that some people when they swim, not to be gross, but get a little mucusy. So you want to make sure that you're not wiping your nose with your hands and touching things. But beyond that, swimming is probably one of the safer sports we have, especially if it's indoors, especially if you're not sharing lanes, and especially if you're hand sanitizing before you get in, hand sanitizing when you get out, and again, mask back on or face covering back on when you get out of the water.
One of our challenging sports that I think we're going to have a tough time bringing back, Carl's asking, what is the likelihood that wrestling's going to happen?
Yeah. I think we don't know is the right answer. I'm hopeful. Again, I'm really hopeful that we're in a different place in October, November. I'm hoping we're in a different place with disease prevalence. I'm hoping we're in a different place with testing. Those things I think are going to be necessary to get a sport like wrestling, which is so close contact, back up and running. But I wouldn't count it out yet. I think that there are lots of people trying to move this in the right direction to try to get us there.
Okay. All right. So I think, again, let's recap about our phases, right? So now we're back to playing. We talked about our red line. We talked about shutting down. And it's almost cyclical, right? So if we do shut down, or we're in a place where our athletes have been missing training, we need to start training again. So we're kind of going back to the beginning, right?
It depends on how much time they're out of sport, but yes, anytime we shut down for 2 weeks or more, where they've really lost some training time, we need to restart. Now, Again, we can encourage our athletes to do whatever virtual training they can, right? Running outside, riding bikes. There's lots of ways to stay fit and active. There are lots of teams that have come up with some really creative virtual training programs where kids have a basketball and they're in their own garage or in their own driveway or the sidewalk in front of their house, and the coaches are running them through drills. The Wizards actually have an online basketball camp happening right now, which is really interesting. My kids were doing it last night. They were having a great time doing the drills. So there are some ways that you can stay active even if the whole team has to shut down. We really need to be cautious for people who are ill or are strictly quarantined, who really have to stop all activity for a time. They really are going to be back to square one and doing that gradual retraining back to reconditioning.
Mm-hmm. We have a lot of questions coming in from our listeners about soccer. That kind of seems like one we can really spread out. We can maybe reduce the use of our head and hands and really just go to a lot of footwork. So what comments do you have about that?
I think soccer is one of those sports where we could certainly start talking about training in small groups. And when competition comes back, I think is going to look different for different leagues and different groups. But I agree. I think we can get out on the field. We can do some training. We can do some footwork. We can do some distant passing. The things that we've heard from clubs that are doing this really well, minimizing the amount of gear that the kids bring to the field. So we really don't want them bringing, their whole giant bag with all their stuff. Really, we want them bringing themselves. And if they are going to bring gear, everyone gets a drop zone. And that drop zone is spaced 6 feet apart so that they're not all bags piled up on top of each other. Many of them are, every time they come in for a water break, they've got hand sanitizers right there. So they're washing their hands. Absolutely, everybody gets their own water bottle. We're not using the big shared coolers. We're not using the hose. So there are a lot of ways I think we can mitigate the risk associated with soccer. And I think that it's great. Let's get them back out there again, starting in small groups, and then we'll gradually start moving them back through.
So I'm a parent taking my kid to soccer practice. Do I wait in the car?
Yeah, probably, right? So, and I'll say this as a parent who took my son to baseball practice earlier this week. Yes, I think so. The temptation to sit on the sideline and watch, the temptation to gather close to the other parents and chat, I think is just too great. I'll tell you that I think that that's going to be the big challenge with competitions when we get back to competitions as well, is really spectating as family units, minimizing who goes to the game. Elderly relatives with medical problems probably should not be coming to the games. People should really probably be sitting as family units. The unit that lives in my house can sit in the chairs right around me. The next group of chairs should really be 10 or 15 feet away. I mean, at least 6.
So we should avoid our bleacher seating. Probably a good idea to shut those types of things down, which I know some of our local parks have already done. So really have your parents just sitting in their families.
Yeah, sitting in groups, or if they are using bleacher seating, being very intentional about separating. And again, the use of masks and face covering. I know they're hot, and I know we all want to take them off when we get outside, but when we're in a social group like that, where we're all watching a game or spectating, even if that next person is 6 feet away, again, as I'm cheering and yelling for my son, my droplets may be traveling a little bit farther than they would in this conversation. So I protect the people around me by keeping my mask on.
Okay. Any other comments you have for our listeners today about any recommendations for the way our parents should be communicating with one another, or any recommendations for any other precautions that our coaches should be taking?
So I think that there are some great resources out there. We'll be linking some here. We've been trying to collate them together on our MedStar Sports Medicine webpage, and those will be available to everybody. I think as a parent, if your kid's coach or league or team is saying they're getting up and going and you haven't heard anything about the precautions they're taking, ask what precautions they're taking so you know what the steps are. You know if you feel comfortable with that as a parent putting your kid into sports. As coaches, same thing. If your league says we're going back and you want to know what the plan is, you need to know what is your responsibility as a coach, what are the guidelines you're going to be following, and under what conditions are you going to have to pull back a little bit. And then for everybody, make use of all of the technology that we've got. For people who have access to things like virtual meeting spaces, whether it's Zoom or WebEx or any of the others that are out there, to do educational sessions. If you're going to do film sessions, do them that way rather than all together in a room. And again, some of these virtual workouts, let's get the kids moving. If we are going to do school virtually or hybrid model in the fall, especially for the little kids, make sure you incorporate those PE classes. I think a lot of people are skipping the virtual PE, but make sure the kids are getting outside and doing some amount of fitness, because I think that it is so important for their physical and mental and emotional well-being to keep moving.
Okay. Any other questions coming in from our listeners? All right, I think that's an awesome place to stop. I really look forward to doing some more of these with you. As the questions keep coming in, we know we're already have more and more questions that we'd like to ask you. Any other closing comments?
No, again, for people who are interested, we are always here to answer questions. As a group, we are happy to support the community, and we are all eager to get back to sports just as much as you are.
So thank you all so much for joining us today on Facebook Live. For more information, we'll have a call to action within the comments. And to become a patient of Dr. Hudson's, or for more information on Dr. Hudson or our programming here, you can give us a call at 888-44-SPORT. Thank you.